As you can see, the Health Secretary, Matt Hancock, joins us once again in the studio. Good to see you this morning, Minister.
Thanks for having me.
So much to talk about, but I think many people will immediately have focused on words from the Prime Minister yesterday. He suggested that it may be that we need to do things in the next few weeks that may be tougher. What did he mean by that?
Well, we keep these things under constant review, as you know, and as we've shown. Unfortunately, the number of cases is rising, and in some parts of the country, so for instance, some of the Tier 3 areas are seeing sharp rises in cases, and each week we look at all of the areas of the country to check that they're in the right position in terms of the tiers. But it is a very difficult situation in terms of the growth of the virus. But then we also have this very good news this morning.
Indeed.
It's a real pivotal moment with the arrival, actually, in the hospitals of the UK, of the Oxford vaccine.
But just in terms of the national lockdown, I suppose, as you know, by the Leader of the Opposition, that isn't within the government thinking then right now, is it?
Well, we don't rule anything out, and we've shown repeatedly that we will look at the public health advice, and we'll take the public health advice in terms of what's needed to control the spread of the disease. Now, this new variant is much easier to catch. It's much more transmissible. And we're now seeing the effect of that in lots of different parts of the country, unfortunately. And it means that, you know, whereas the old Tier 3 was able to contain the old variant, that is proving increasingly difficult in all parts of the country.
Where, though, is the evidence that Tier 4 is able to contain it? I mean, if you just look at London, being in Tier 4, since, the beginning, middle of December, let's say. I mean, if you look at the results in the week up to the 29th of December, which clearly don't include any transmission that took place over the Christmas bubble, over the Christmas window,
yeah.
We are seeing cases accelerating out of control here. I mean, do you still think Tier 4 works?
Well, it's down to people's behaviour, frankly. What matters is, yes, of course, the rules that we put in place, but it's also about how people act. And frankly, what I'd say is this. It is critical that everybody in the country does all that they can to reduce the spread of the virus. But
clearly they're not doing so. There are either two things that are happening here. Either the transmissibility of the virus is such that Tier 4 in and of itself isn't enough to control the spread of the virus, to even bring it down to slow its spread, or, as you've just suggested, it's our fault. People aren't adhering to the rules. So what do we do then?
So I'd put it slightly differently.
Okay.
This is a massive national effort, right? It's a massive team effort across the country as a whole. We have our part to play, of course we do. Mm-hmm. But whether it's on keeping the virus under control, or whether it's on the rollout of the vaccine and all of the work alongside that. This is a massive national effort, and it's on all of us. So this isn't about blame. It's about how we collectively, as a society, keep this under control for the next couple of months, these weeks of winter that are going to be very difficult, until the vaccines can make us safe. And on that, we obviously have the very positive news this morning of the Oxford vaccine starting to be rolled out. It's that's a triumph of British science that we've managed to get to where we are. But this new variant does make it so much harder to control the vaccine in the meantime.
But just in terms of the vaccine, look, every day on this programme we repeat the statistics about the number of new cases. We repeat the numbers of people who've died with a positive COVID-19 test. We'd quite like to provide some accurate information, daily information on how many people are getting vaccinated. Because frankly, that seems like one of the few good news stories around at the moment. Could we get that information from your department on a daily basis?
Well, we publish it weekly at the moment, and we've been working so hard with the NHS, doing such a brilliant job to get this up and running at pace. Mm-hmm. We've obviously delivered more than 1 million vaccines into arms already. Mm-hmm. That's more than the rest of Europe put together. I'm really proud of how the NHS have really risen to this challenge. From today, we accelerate that path. We've got, from today, 700 vaccination sites open across the UK. By the end of the week, it's due to be over 1,000. So there's plenty of statistics. I can keep going. I'm really, really pleased. And the whole of the NHS is leaning into this incredibly important national effort. And it's only because right at the start, we saw that the vaccine was the only way out long term. We backed the scientists at Oxford. And we teamed them up with AstraZeneca, who themselves are doing a great job. And now we have this big British success story starting today.
But we'll see in a few. We'll have to leave it a few weeks until we get to the point of saying that we've got the vaccination programme going quite as you'd like it. And daily information would help us in assessing that. But just in terms of the vaccines, a huge amount of concern about a change to the protocol, the distance between the first and the second doses. Explain this one to us, because there are plenty of people who suggest, well, I took that first vaccine on the promise that I would get the second one as scheduled. Why is that not happening, and how concerned should people be?
It's a really positive change for the country as a whole, and indeed for the world, that you can wait until 12 weeks to get the second dose. And the signs with the AstraZeneca vaccine are that you get a better protection if you wait that bit longer.
Can you give us percentage terms of
well, the scientists
75 to 80?
The scientists have settled that out, and also these percentages, you've got to be careful, because that's a percentage of what, right? Because actually what we're looking for is not only, obviously, people not catching the disease is the best protection, but also the vaccine, even if you do, it protects you from serious disease. These vaccines are effective and they're safe. And the critical thing is, since we have these doses available, do you use any 2 doses to dose 2 people to give them that protection, which starts after the first dose? Or do you give one person 2 doses, which actually leaves somebody else without that protection at all? So imagine if you've got 2 grandparents and you've got 2 doses of vaccine. Sure. You want to give 1 each, because then they both get that protection.
Yeah, and indeed, Chief Medical Officers of Wales, Scotland, Northern Ireland, England, all in parity on this. In terms of schools, however, we have a situation this morning in which there will be primary schools up and down the country, contrary to government advice, not opening. What is the government going to do about that?
Well, I think on schools, it's incredibly challenging, because obviously keeping kids in education is so important. As the Prime Minister said yesterday, we will follow the public health advice on schools. In the areas of the country, like London that you mentioned earlier, where the disease has spread the broadest and the pressures on the NHS are the greatest, there we are not opening primary schools. But there are pressures across the country, and that's why in the parts of the country that we have set out...
Yeah, we have a situation at the moment in which there are, local authorities in direct contravention of the advice coming from the Department for Education, telling their head teachers this morning, if you want to close the schools, that's absolutely fine with us. It's a rather chaotic situation. We have the NEU, NAS, UWT, all of them saying schools are not safe, not just for pupils to go back into, but for teachers. If frontline professionals in the education system are telling you that they are not confident going back into school, on what basis do you say that schools are safe?
Well, on the basis of the public health advice, which I think it's incredibly important as the core question that we're facing is, how do we deal with this pandemic? And the public health advice is absolutely critical to that. So that's what people should be listening to.
The advice is that the data suggests that young people are less affected by the more severe effects of the coronavirus. That doesn't mean it's safe for teachers.
Yes, it's also clear that the proportion of teachers who catch coronavirus is no higher than the rest of the population. So, there is clear public health advice behind the position that we take. And that is what people should follow, because, of course, education is very important as well, especially for people's long-term health.
So you've got to... There are people watching this morning who know that in their area, where primary schools are opening this morning, there is a similar infection rate to that in Tier 4 London.
Well, you've got to follow the public health advice, and that's what we are doing in this space, whilst also, of course, part of that public health balance is the fact that education is incredibly important to the long-term
I'll say it
prospects
again,
of children.
I'll say it again. There are teachers up and down the country who don't believe you. There are head teachers up and down the country who are in direct disagreement with the Secretary of State for Education this morning. It's pretty chaotic, at the very least.
Well, I think that that's a challenge that we have across the whole of this response to this pandemic is you do sometimes have to move fast. And we have moved fast, for instance, in saying that London schools shouldn't come back based on that public health advice. And I know sometimes we get criticised for moving fast and changing things, but that's what you have to do in a pandemic.
But can't we act in anticipation? We know that the data doesn't accurately reflect the transmission that will have taken place in domestic environments over the Christmas period. We know that the case numbers are only going to get worse. We know that the rate of transmission is only going to get worse. Why are we waiting to go for a full national lockdown?
Well, we've acted very rapidly to put areas into Tier 4, and obviously we keep that data under review all the time. And so that's a critical part of the job that we've got. And we then act very fast. So, for instance, when we saw the new variant arrive in, and we got the advice on the fact that it's more contagious, it transmits so much more quickly, we then acted within 24 hours to put that into to put in further measures that needed to be taken. So absolutely we're prepared to act when it's necessary, following and listening to that public health advice.
Mr Hancock, good to see you. A busy few weeks ahead. We'll let you get on with it. Thanks for joining us.
Thank you very much.